709 cases of COVID-19. This is a 28% increase in cases since yesterday. At least 50 new positive coronavirus cases have been registered from a church in the Free State. The health minister has explained that the spike in that province was all linked to the Jerusalem prayer breakfast hosted by the Divine Restoration Ministries in Bloemfontein. The minister joins me now in studio. Dr. Mkhize, thank you so much for your time. Really appreciate it.
Thank you very much, and good afternoon to the viewers and the listeners.
So 709 cases is where we're sitting right now. I know you've previously indicated that we should expect an increase in cases, but should we be concerned about this sharp increase?
We should just be concerned with the fact that we do have coronavirus. The concern doesn't mean we must panic, but it also means we must be determined to get rid of it. That means that we must all do as asked, because there are ways of reducing the impact of the infection. There are ways of reducing the spread of the infection. So we are concerned about the increase, and the increase is going to continue. But we must say that at the end of the day, what steps government has taken now are aimed at actually ensuring we can reduce the numbers of people who are infected, ultimately defeat the spread of the infection.
Are we seeing more internal transmissions? And what does that say about the trajectory that this virus is now taking?
Well, the large majority, about 75% of the infections are accounted for by people who have either traveled out of South Africa or those who are returning South Africans or those who are visitors into South Africa. Now that, of course, we knew that's going to be the starting phase of the infection. Later, we're going to start having contacts with those people spreading within our community, what we call internal transmission. We are getting to that phase at this point, and that's why the President and the Cabinet has taken a very serious decision that we must take drastic actions to reduce the internal transmission. That's really where we all are, because it now means all the South Africans, particularly communities, families, individuals, everyone needs to take responsibility for ensuring that this virus doesn't continue to spread.
And Minister, the public health sector won't be able to carry the burden should these cases increase and more people need hospitalization. Are we going to get to a point where the private sector can accommodate people who are sick as a result of this virus but may not have medical aid or afford that private health care?
We are at a point where we're actually counting all the resources, public and private, as being what we have available to fight this virus, which means we're now counting on the public and private beds, public and private hospitals, public and private laboratories to be able to join together in the fight against this infection. So at the end of the day, government would like to be able to utilize all these beds with the agreement with the private sector.
But are those discussions going well in terms of reaching some agreement?
The agreement is there. It's a principal agreement to say that we are counting all the beds. Just to give you a sense, we're working very closely with the private sector. In terms of the private laboratories, all of them are working with the government, and all the information goes through the National Health Laboratory Services of the government, but a number of private laboratories are doing the tests. That's the coordination that we've put in place. Anyone can go to any of these, and therefore it's going to be one center that's going to deal with the total numbers so that we know where the information comes from. When it comes to the issues of hospital beds, we are actually accounting for everyone. If you are admitted in the public hospital or private hospital, it's the same thing. You are admitted. So when we get to ICUs, we will do our own internal arrangements between government and private sector to be able to utilize those, so that when we count the numbers. So right now we're already discussing with the pharmaceutical manufacturers and the manufacturers of medical devices, so that where we think there are shortages, we're going to have to open up. We have seen the exemption rules that have come from Competition Commission and DTI, which are actually allowing us to sit together. We're already sitting together. We're looking at who's got what stock, where can we move the stock from private to public. We're looking at how many beds, where do we need to get new ventilators manufactured, how much medication do we have, where can we source it together, Where do we get the test kits? They must be all available for everyone. At the end of the day, which side South Africans would have come into the system, they must find that whatever we have in stock is available for all.
Does it include testing as well? Because one of the questions I got earlier was, are people allowed to go to a private facility, health facility, and test? Because now when you go to a laboratory, you have to pay over 1,000 rand, and some people fit the profile of testing, and they are concerned that they may necessarily not have the money to pay at a private laboratory.
Well, the test is done on the basis of clinical criteria. So the doctor and the nurse will actually take those criteria into account and therefore refer the person for testing. So all the people that who have gone for testing, we expect that they should be fitting the criteria. And the criteria is that someone must either have traveled to the countries that are mentioned, which are epicenter, or would have returned from those countries, or has been in contact with someone who's been into those countries, or has been in contact with someone who's actually positive, but must also themselves have symptoms. And we've described the symptoms as a cough, a dry cough, or a cough, and then a fever, and a sneezing and upper respiratory symptoms. All of this is how we guide. Otherwise, we don't have enough resources to test anyone who wants to know. So we don't think that you should just want to know unless you've got symptoms, and that's how we really classify it.
What about the state of readiness for health professionals? Some doctors and nurses have been raising concerns about their state of preparedness. They say that training hasn't been sufficient, that there's no protective gear for them, well, at least sufficient protective gear, and they are scared, seeing how the virus is playing itself out in other parts of the world where health professionals are now being infected. What do you say to them? Is there a plan to increase training and to provide that protective gear?
The training is increasing. We started by those who are actually in the direct area of contact, those who are going to be dealing with the infectious disease isolation area. Those have been well trained, and then we're actually expanding the training. So it's possible that media could interview someone where the training has not been extended to, but we expect that over a period, everyone should be well trained to understand how to deal with the issue of the COVID-19. The equipment is available, and we have actually we're dispensing it to those who need it immediately. And of course, with time, we're going to see that the need might be increasing. But we must say that at the moment we are coping. As you will notice now, we've got 700 patients. We don't have a problem at this stage. Many of the people don't need to be admitted. They can be treated at home. Many of them have got mild symptoms and they can recover. So at the moment we've only got 2 that are critical, but there were more. The others have actually been discharged. So we are quite happy with that. We have not had any death at this moment, and we've also seen some who have actually converted to be negative. 5 of them have, and so we are actually making progress, because even those who've got symptoms are largely improving on the symptoms. We are simply not calling them recovered, simply because we're waiting for the test, so that we know that whilst the symptoms have gone, but at the same time that they are no longer infectious, as the test will confirm.
I want to talk about some medication now, because there are people who are scared of using certain medication for even flu, even inflammatory drugs like ibuprofen, because some experts have suggested that the reason this virus has affected so many in Italy is because they've used the drug that made COVID-19 symptoms so worse. Is there any scientific reasoning to this? Have you looked at this as government?
Yes, actually, we've seen the writing that's been reported. I had a whole team of specialists, professionals, clinicians, who have actually dismissed it, and they've said that it's not correct. And so there is no link between ibuprofen or anti-inflammatory agents with the spread of the infection. However, if there's any work that's being done at that level, we expect that our clinicians and our researchers will be able to inform us about those. They are in touch with a lot of trials that are going on. Sometimes when there's a report about one trial or one person who makes a speculation, then it carries out throughout the media. But it's not necessarily true.
I want to focus on the lockdown now and what is hoped will be achieved in terms of containing the spread of the virus. From the projections that you have looked at as government, how are you expecting us to battle this virus? Are we looking at 5 more months, 3 more months, this whole year? What are the projections telling you?
Well, we will have some of the projections very soon because we're having our epidemiologists trying to study various models. There's nothing typical. We're not the same with a number of other countries, so it's taking a while to give us those projections. At the moment, the projections are fairly wide. But what we expect is that this lockdown is about stopping the spread of the infection. So here we expect everyone to just stay at home. We want to discourage people from traveling from one province to the other, from one big city to the other. We also want to encourage people to just stay at home. And so we believe that what's important is to cut the movement of people in such a way that you do not increase the chances of someone getting the infection.
And speaking of staying at home, Minister, and I'm glad you've raised that point because a lot of people have been saying they want to go home. In fact, we've seen an increase in traffic on the N1 of people driving to areas like Limpopo. But as government has been stressing over the last couple of days, maybe it's better to stay where you are right now. People have been concerned about what they'll be able to do during this 21-day lockdown. Many have asked, can they jog? Can they take their pets for a walk? What is allowed and what is not?
Well, let me say, we really prefer that people must stay at home. If people can stay at home and there's no movement, it's best for us. And if people were to go out and jog, it has to be a very short distance and must not be in crowd, and therefore they must not mingle and must not mix. But it really has to be something that's very short, because the problem is that we don't want to suddenly see a whole crowd of people out there, each one saying, no, I'm jogging, I'm taking my dog. When that happens, we're going to start dealing with crowd control, because that means that people are out there. But there are instances where people will go out for certain essentials, and therefore we say that people must really be very responsible about how they manage this whole situation. When we look at the whole question of lockdown, we are basically saying that when, if you look at any one day, people who are traveling in taxis, in the aeroplanes, in trains, the numbers are such that if now we've got internal spread, it's very easy for people to get infection from one to the other. So we're wanting to limit that. And if you do that over a period of 3 weeks, there are a few things which can be very useful from the point of view of the pathogenesis of this viral infection, which basically means that a number of people within 14 days will show whether there were symptoms. And so we can quarantine those who are contacts, and those who are on treatment can also be treated, and they can improve during that time and shed the virus out of their body. And those who might have had the virus would have shed the virus in such a way that we would actually limit the virus will be shared by people who have not infected others. That's how you're going to shrink the virus from spreading. That's how you see the reduction of the numbers of people. So it means, therefore, that if you were to look into the trains and taxis, 16 million people travel every day. If one person coughs through, 2 coaches and two taxis and spreads the infection, more people are vulnerable, but they can never know that in fact that person was infected. And when they discover that they had the infection, it will be much later. So that's really the reasoning behind this whole issue. Okay.
I'm taking your calls now on 011-883-0702. What questions do you have for the Minister? 021-446-0567 if you're in Cape Town. You can also send your WhatsApp voice notes on 072-702-1702.
Hi Clement and Minister Mkhize, thank you so much for everything that you've done for us.
Thank you.
My question is with regard to my pregnant wife. Would we be able to go to hospitals to do checkups for scans, etc., given that my wife is 24 weeks pregnant? Thank you very much.
Yes, you should be able to do that. The lockdown means that the exceptions are essential services. It's like health services, security services, where people have to be protected from crime. It's also about going out to look for food and basic essentials. Those exceptions are understandable. And in this case, we are classifying health services as essential services. Not only just health as in hospital, but people are involved in the value chain. Those people are involved in the production, delivery, and logistics logistics of medical supplies have to be working so that no hospital must run out of medicine, and so that whole group of activities are allowed.
Minister, someone else wants to ask on Twitter, why are we allowing people on the streets jogging and walking? And this person says these pockets of concessions are going to be abused. Are you not concerned about that, especially because you won't be able to regulate and say this as how many people can come out of this complex, out of that complex? So how are we going to make sure that we don't end up being congested on the roads because every one of us wants some fresh air and wants to go jogging?
Well, you see now, I think we can always be taken onto controversial issues and we may not be able to answer all the questions. What we prefer is people to stay at home. And I've just said if people were to do it and it's a very limited and you don't have a crowd, it may not be such an issue. But once you start having a crowd, then we have to really deal with crowd control. The question of what concessions you do, just now we've said people must stay at home. People are already traveling. We have to discourage them from doing so. People will always find a way to get around something that we've said, look, don't do that and so on. One of the issues that I'm very worried about, and if I were to talk about the real things that I worry about, is that people will then must not say, now President has declared a lockdown, so that's going to sort out the virus. So we can go and do a party. We're not 100, so we can do a party. You can't do that. You can't also go and sit as a group and start boozing together, and then you're smoking together, you're coughing together, and even if in-house. So you can stay in-house, you still have to observe certain basic issues of hygiene and social distance. So there's a responsible conduct that's important. So you're going to find people who are going to say, what are we going to do? Let's go to so and so and have a nice braai. 30 of them are sitting there. You actually are going to spread the virus. So when we say people must stay at home, we're meaning that. But we are not saying you can stay at home and actually do the wrong things again. So the issue is people must just understand, please be responsible. We don't want to be going out there and controlling crowds unnecessarily. We also don't want to be going to check your houses to see that, you're all sitting there smoking together or coughing at each other and so on. You must take this responsibility. So my message is simple. You can stop the virus by observing what we have said needs to be observed.
All right, let's go to the lines now. Kenosi, you are in Muruleng. What's your question for the minister? Good afternoon.
Good afternoon, sir. I just wanted to know, because I've got an appointment at the hospital on the 15th. Will I be allowed to get there?
All right, the minister will answer that, Kenosi.
Yes, will be allowed.
So you will be allowed to go there. In fact,
anyone who is sick is allowed to go to the doctor and to the clinic.
All right.
To the hospital.
Thank you so much. Thanks so much, Kenosi, for that call. Peter, you are in Road des Grounds. What's your question for the minister?
Hello, it's Peter here. Good afternoon, Minister.
Good afternoon.
I would like to know, why are people not talking about heat to destroy, dehydrate and destroy the virus? There are heaters in planes, there are heaters in cars and buses and everything. And even if they stand overnight, they can run the heaters, make it hot, and destroy the virus. Why are people not doing that?
Okay. Peter, thank you so much for that call. So, Peter, they're wanting to know if heat can indeed kill the virus, because that's what a lot of people are talking about.
Well, there's discussion about whether there's an impact of the temperature on the virus. We don't have conclusive evidence, so we wouldn't really encourage people unless we've got scientific advice that says we must do that.
All right. Lehlagonolo in Midrand, good afternoon. What's your question?
Good afternoon, gentlemen. Good afternoon, Minister.
Good afternoon, sir.
Great work, Minister, that you're doing. Minister, I'm just asking, we are all in this thing together and we want to help. We want to help government to get rid of this thing. I'm asking about what will happen when this pandemic, we have stopped this pandemic, we don't have infections anymore. What measures are you taking to make sure that we don't get this thing again? Remember that this thing came through people traveling. You understand? Because now we cannot have a situation whereby we know that 90% of people that are traveling going overseas are people who can afford to go through this 21 days with food and all on their table. But the rest of us, we can't.
Okay.
So we need to make sure that this thing doesn't come back. What measures are we taking?
All right. Thank you so much for that comment, Minister.
Well, I think we need to be realistic. Firstly, this virus is going to be with us. Right now, it's almost 196 countries that have got it. So it's going to be resident amongst us. Well, I think what's important is to recognize what we can do to prevent the spread, to recognize the symptoms, and also to go for testing. And later on, once this virus has receded, we still have to keep to all of those practices, because that's how we manage to reduce the spread of the infection. Now, traveling, we're obviously going to have to work out what precautions we have to take when people have to start traveling again. Remember, traveling is not just a simple issue. Businesses depend on traveling. Tourism depends on traveling. A lot of hotels and lots of restaurants, actually people have earn a living out of that. Right now, we've got supplies that we must get from various countries. There has to be boats coming in. There has to be aeroplanes coming in. So we can't live in an isolated area. So we're going to have to talk about what do we do. Basically, this is going to change our culture of how we conduct ourselves for good, and also how we're going to deal with issues of inward traveling. So we'll have to talk about that at that time.
Lenaka, you are in the Pretoria CBD. Good afternoon.
Good day, Clement. I just wanted to ask you, the Minister, with regard to health professionals going to work, mostly in private, is there any form of a documentation that needs to be produced in case we get stopped on the road to ask where we're going? Is there any form of documentation that we need to show to the authorities?
Well, right now we're discussing that. It's a bit difficult to implement it within such a short space of time. We will actually be looking into what else needs to be done. But we believe that just identifying yourself as a health worker needs to be able to allow people to go through. We're not really searching out for criminals here. So we're not like hard and fast. We're actually trying to facilitate that people's services must not be undermined. So we'll discuss to say what's the best way of ensuring that people are properly identified. But right now, we're going to just ask people to just, whatever they've got to show, if they're wearing uniform, that would be useful. If not, they should try and be able to just show something convincing. But we don't have anything specific that we've put on the table. We just hope that people are going to be honest so that we can deal with this thing. If we come across problems, of course, I'm sure we'll find another way of being able to solve that problem.
Hi, this is Wanyile from Katlong. I want to know from Dr. Mkhize, what steps are they going to take about those churches who are keep on making big gathering, and spreading this disease? Please, I want to know what steps are they going to take, because they are really infecting innocent people.
Well, I would like you to report that you could actually notify the police if you think the churches are too big, and we'll ask the police to discuss with them to make sure that that situation does not continue. We've already got evidence now that those crowded meetings can infect many people. I was observing 3 churches in Korea. The first one is now responsible for almost 60% of the infections in that country. The second one, last week, I was told by Ambassador that the numbers had increased to 61 by that time. Now, Free State is half of that.
Yeah.
So that has to be we must take it seriously. So we will actually ask people to report such instances, and that we're going to ask police to go in and deal with that situation and ask people to avoid it. We have actually been very respected by religious leaders. Large churches have actually asked to cancel, they've agreed to cancel the Easters. That's really a very responsible step of saving the nation. And so I would like everyone to heed the call of the president.
Just lastly, Minister, there's a question here. Some people may think it's bizarre, but I think, people are asking this question. Someone is asking, why is it that we have a high number of infections and no one has died? By this time, other countries were on this rate. They had a number of deaths. By the time other countries were at, I suppose, 709 cases, for instance. Why is it so different with us?
We in Africa had the world had about 130,000 people who had infection, and Africa had none. And people were starting to say there's something wrong in Africa. Maybe we're not recognizing the infection. So we cannot tell what the issue is. That's good work for research. But in this case, I really don't wish that we should have had any death by now. And I also think we don't have any in the future. So it's something that we just need to check. The conduct of the infection is not the same everywhere. We think it's early days. So we really want to be very open-minded about it, and we will actually be observing what the pattern is in our country. So with time, when we get more information, we might be able to answer such a question.
Minister, I really appreciate you coming through and giving us over 30 minutes of your time. Are you getting any sleep?
Yes, I am getting sleep, but let me say, I'm very impressed with the way South Africans have responded. We get lots of messages of support, and I want to say thank you to South Africans, to the president, to the ministers, to everyone. We really take that very, very seriously, and we appreciate it. But we also are aware that the question they're asking, people are serious about it. Let's keep to the seriousness of it. Let's avoid fake news. Let's correct each other when we do wrong things. It's all up to us, not the president, not cabinet, not the professionals, not the doctors, not the nurses. I myself as an individual can reduce the spread. Me as a family and as a community, we can reduce the spread.
All right. Thank you so much for your time. That's the Minister of Health, Dr. Zweli Mkhize.
For more, go to ewn.co.za.